So I will be going to discuss about lung abscess. I have here the learning objective. On completion of this topic, the learners will be able to define and understand the definition of the lung abscess, determine the classification of the lung abscess, the primary and secondary lung abscess, understand the causes of the lung abscess by knowing the aerobe and anaerobe bacteria that causing lung abscess, identify the signs or symptoms of lung abscess, determine the complication of the lung abscess, and the last one is to find out and evaluate the diagnostic findings, the treatment of the lung abscess, and its nursing intervention. So first, we are going to discuss what is lung abscess. A lung abscess, it is an abscess that localized collection of pus caused by microbial infection. It is generally caused by aspiration of anaerobic bacteria. By definition, in a lung abscess, the chest X-ray demonstrates a cavity of at least 2 cm. So, lung abscess is one of the respiratory infection which is defined as necrosis of the pulmonary tissue and form a cavities. And that cavities is containing the necrotic debris or the fluid. So, let me show you a short video for lung abscess.
Here is a lung. Here is a major fissure between two lobes. Here is a very distinct lesion within one of the lobes. Notice it's well defined. Notice it appears to have a semi-liquefied and semi-necrotic appearing cut surface. But notice especially that the lung around it appears to look more like liver. It has the appearance of being more edematous and consolidated is the word, rather than air-filled. You could appreciate that here and here and here, which you would expect that if you were to squeeze it with your hand, you wouldn't find many air bubbles. So it is less crepitant than normal, or it would be what pathologists call consolidated.
So next is, we have classification of the lung abscess. We have primary and secondary abscess. So ano yung tinasabi nating primary abscess? These are infectious in origin that caused by aspiration or pneumonia in the health host. And the secondary abscess, these are caused by a pre-existing condition, like for example is obstruction, which is spread from an extrapulmonary site, bronchiectasis, and immunocompromised state. The next is, we have pathophysiology. So, the most lung abscess are a complication of bacterial pneumonia or caused by aspiration of oral anaerobes into the lung. Abscess also may occur secondary to mechanical or functional obstruction of the bronchitis tumor like foreign body or bronchial stenosis, or from necrotizing pneumonias, TB, pulmonary embolism, or chest trauma. So the other mechanisms for lung abscess formation is include bacteremia or tricuspid valve endocarditis that causing septic or emboli to lung. The next is, the oral anaerobe F. necrophorum is the most common pathogen. So I have here the sample of anaerobe bacteria such as Streptococcus species, Bacteroides species, Fusobacterium species, and the microphilic streptococci. And for the aerobic bacteria that may infrequently cause lung abscess include Staphylococcus aureus, Streptococcus pneumonia, Nocardia species, and the gram-negative bacilli. Clinical manifestations. So, symptoms of the lung abscess commonly come slowly over weeks. They include chest pain, cough, fatigue, fever, coughing blood, night sweats, sputum with pus that's often surfacing, foul smelling, or the streak with blood. So this is the illustration of the signs or the symptoms of the abscess. So for early signs, we have fever and chills, night sweats, and persistent cough. And for the later signs, we have pain with deep breathing, coughing blood, and the fatigue. So there are some complications for the abscess. So the possible complication of the lung abscess include chronic abscess, emphysema, bleeding, and bronchopleural fistula. So as you can see in the picture, yan yung sinasabi nating complication. So in that infection, yung infected area ng lungs is nagbi-bleed na siya, and the other picture is naging malala na yung infected area ng lungs. And as you can see yung sa baba, yan na yung tinatawag nating emphysema thoracis and bronchopleural fistula. The next is we have assessment and diagnostic findings. For the diagnostic findings of this abscess, meron tayong chest X-ray and the CT scan of the chest. So the physical examination of the chest may reveal dullness on percussion and decreased or absent breath sounds with an intermittent pleural friction rub-on auscultation. So, and also the confirmation of this diagnosis is made by chest X-ray, sputum culture, and in some cases, which is fiber optic bronchoscopy, and a computed tomography or the CT scan of the chest may be required to provide more detailed images of the different cross-sectional areas of the lung. So I have here the video for the findings of the lung abscess, which is the chest X-ray findings.
A lung abscess typically appears as a focal round mass with a central cavity and a gas fluid level. The outer wall of the cavity is poorly defined due to surrounding consolidation, while the inner margin is relatively sharp. Within the cavity is a collection of gas and fluid. A sharp horizontal line divides the dark radiolucency, the gas, from the dense opacity below it, the fluid. In this X-ray, there is a large abscess in the right lung with a very clear air fluid level. The lung abscess in this X-ray is also in the right lung, but a little less obvious than in the previous X-ray. This abscess is in the left lung and is partially obscured by the cardiac silhouette. Here we have bilateral pneumonia complicated by multiple abscesses. I hope you found this lecture to be helpful and worth your time.
The next is we have prevention. So to prevent that disease, appropriate antibiotic therapy before any dental procedures in patients who must have teeth extracted while their gums and teeth are infected. And adequate dental and oral hygiene because anaerobic bacteria play a role in the pathogenesis of the lung abscess. The last one is appropriate antimicrobial therapy for patients with pneumonia. And for medical management, we have antibiotics, drainage, and surgery. So when we say antibiotics, most people get antibiotics into the bin for about 3 to 8 weeks. You might switch to oral antibiotics. After that, you will take them until a chest x-ray shows the abscess is gone. And for drainage, you may need this if your abscess is about 6 centimeter to more than in diameter. Your doctor will use a CT scan to guide them as they insert the drain through your chest wall into the abscess. And for surgery, it is rare to happen because but some people need surgery to remove the part of the lung which is the abscess. To remove the part of the lungs which is infected by abscess. The next is we have nursing intervention. So the nurse is administer antibiotics and IV treatments as prescribed and monitors for adverse effects. And also the nurse educates the patient to perform deep breathing and coughing exercises to help expand the lungs. And to ensure proper nutritional intake, the nurse encourages a diet that is high in proteins and calories. And the last one is the nurse also offers an emotional support because the abscess may take long time to resolve. So that's all the discussion for the lung abscess.